So hello friends, welcome to my new video. So today in this video, I will discuss with you all about a very important topic that you all should know. So I'm talking about cone rod dystrophy. So let's start. So here, cone rod dystrophy is a genetically inherited disorder that affects the light-sensitive cells of the retina or the photoreceptors of the retina. I'm talking about rod cells and cone cells. So in cone rod dystrophy, or in short, I can say CRD, mostly affect the cone cells than rod. Okay. So this CRD is characterized by the presence of retinal pigment deposit near the macular area. So this is a fundus photo of a cone rod dystrophy diagnosed patient. So I told you how to take the fundus photo, right? First of all, you need to see the optic disc, then vessels, then macular area, then periphery. Disc normal, blood vessels are also normal, but in the macula, you can see the atrophic patches into this macular area surrounding to the macula also. But the most periphery is paired. So that is why cone rod dystrophy patient will not have that much peripheral field defect, but as the macula is atrophic, so that is why the patient will have significant vision reduction as well as central visual field defect, right? So this cone rod dystrophy patient, primarily cone rod are mostly affected. Okay, so this is the comparison between cone rod dystrophy and rod cone dystrophy. So generally, it seems that cone rod dystrophy and rod cone dystrophy are same, but there is a wide difference between them. First, this rod cone dystrophy, other name is retinitis pigmentosa. So this retinitis pigmentosa or RP, here the patient will have first peripheral field defect, but the cone rod dystrophy patient will first have central field defect as well as reduction of vision. But RP patient will not have initial reduction of vision, they will just have night blindness. But cone rod dystrophy patient will have reduced vision, photophobia with glare issue, right? And also central scotoma. So this is how you need to differentiate between these two conditions. So what are the causes of CRD? So CRD or cone rod dystrophy can happen in two ways. Whether it can be due to any syndrome or it can be due to some genetical mutation or abnormality. So if I talk about the syndrome, then Barrett-Biedl syndrome or spinocerebellar ataxia type 7, these are some syndromes that can lead to cone rod dystrophy. But on the other hand, non-syndromic, this is the most common cause of cone rod dystrophy, where it is due to some genetical mutations or abnormality, like here genes like ABCA4, CRX, or RPGR. This gene mutation can lead to cone rod dystrophy. So this is the stages of cone rod dystrophy. Where is the first stage and second stage? First stage, it is very normal. So here, very normal means less severe stage. But second stage is the most severe one. First stage, here the patient will give you initial complaints like reduced vision, photophobia, glare issue, and difficulty to detect colors, central scotoma, and in the fundus you will see the temporal pallor of the optic disc. But the patient will able to walk through here and there, okay, because the peripheral retina is paired. But in the second stage, where the atrophic patches reach to the peripheral of the retina, the patient will slowly start to have night blindness, peripheral field defect, as well as difficulty to move by themselves. So in second stage, you will see signs of first stage as well as including this night blindness, peripheral field defect, and difficulty to move by themselves. So here, types I already mentioned, two type, syndromic and non-syndromic cone rod dystrophy. So here I will discuss this slide picture in the later slides. Okay. So here first start the syndrome. Syndromic causes first, then we will go to the genetical mutation that is non-syndromic type. So the first syndrome that can lead to cone rod dystrophy is Bardet-Biedl syndrome. So it is an associate with post-axial polydactyly. So what is polydactyly? Here the extra projection of a limb or finger, like many of the time you see that some persons have extra thumb finger or little finger. So this is known as polydactyly. Hypogenitalism, mental retardation with mild psychomotor delay and renal abnormality lead to renal failure. So This Bardet-Biedl syndrome, this kind of patients, mostly they are also having cone rod dystrophy. So it is an autosomal recessive condition, and the diagnosis of CRD due to Bardet-Biedl syndrome is done within early 20s. And the patient with Bardet-Biedl syndrome has reduced visual acuity with photophobia happen with a central visual field loss. So how to test or how to see what is the extent of the central visual field loss? So here you can send the patient for HBF. There is Humphrey Visual Field Analyzer where you will perform 10 days 2 or macular cube depending on the patient condition or depending on the visual field loss. And normally there is a very less costly procedure that is known as Amsler grid testing. That is also quite helpful to tell you that yes, the patient is having central field defect. Okay. So here is the second syndrome. This is spinocerebellar ataxia type 7. So it is an autosomal dominant condition that lead to spinocerebellar degeneration. So it starts as a granular macula with a progressive spreading out to the whole retina. At first, the macula become atrophic, then the atrophic area will spread to the whole retina. So here, if you see this fundus, optic disc is very normal. Here, the cup disc ratio is quite zero point 0.5 to zero point 0.6. Blood vessels are also normal. But in the macular area, you can see quite atrophic patches here. And slowly these atrophic patches you can see here in the periphery also. Okay. So here this is because of the spinocerebellar ataxia syndrome. Now here amelogenesis imperfecta. So it is also an autosomal recessive condition where there is abnormality in the tooth enamel along with presence of cone rod dystrophy. So here you can see that the person is not having well developed tooth enamel, and along with it there is macular involvement leading to central vision loss with photophobia. So C and D, these two pictures shows the autofluorescent picture where you can see the macular involvement very nicely. Okay. So here non-syndromic cone dot dystrophy here, as I told you earlier, it is because of some genetic abnormality. Till now, there is 13 genes have been reported that can lead to cone dot dystrophy. So these genes are categorized in several categories. So first category, second, third, fourth. So this category is done depending on how commonly they are causing cone dot dystrophy. Okay. So here, first category includes CRX, RIM1, HRG4. So let's talk about CRX first. CRX gene. So this gene control rod cone photoreceptor differentiation and survival. Most CRX gene mutation cause autosomal dominant CRD with present prevalence of 5 to 10%. So this CRX gene mutation is also cause Leber congenital amaurosis and PURP cases also. Other two genes in first category are RIM1 and HRG4, in which RIM1 gene is autosomal dominance and the genetic inheritance of HRG4 is unknown. So let's go to the second category. So here second category here ABCA4 gene. So this gene can also cause Stargardt disease, and mutation of this gene lead to 30 to 60% of cases of autosomal recessive CRD. So it is also observed that due to abnormality in this gene lead to Stargardt macular dystrophy and later affect the periphery of the retina. And if I say about the GUCA1A, so this gene cause autosomal dominant cone rod dystrophy cases. If I talk about the third category, so third category includes this peripheral RDS. So this gene cause autosomal dominant retinitis pigmentosa as well as autosomal dominant cone rod dystrophy. And the other gene for cone rod dystrophy is RPGR, and CRD caused by RPGR are very severe and diagnosed early in life. In the fourth category, there is RPGRIP1 and AIPL1. This gene also causes Leber congenital amaurosis, and GUCY2D gene causes dominant condition of CRD. So overall, the genes mentioned in the slide are responsible for RP and other renal dystrophy. Also, it causes chondrodystrophy. It also seen that there is same family, some member of that family having retinitis pigmentosa and some member have chondrodystrophy. How you will diagnose a case of chondrodystrophy? So the diagnosis is mainly based on the patient complaint and history. The patient complain you with a visual field loss, gradual visual field loss, as well as photophobia. And in fundus examination, you will see macular atrophy as well as atrophic patches to the periphery also of the retina. So the main diagnosis is made by multifocal ERG, and genetic counseling also help very much in diagnosing this condition. This is the ERG procedure performed in this picture. Now, in some RP cases also, it is seen that there is a defect in the macula as well as periphery of the retina. So that lead to confusion to diagnose the case of CRD, whether it is CRD or RP. So in this condition, ERG plays a very vital role in diagnosing. So how to manage? Currently, there is no known treatment for CRD as well as RP. So there are several therapies to slow down the degenerative process. So treating the complications of that condition like cataract or macular edema, etc. So treatment is similar to treatment of RP. Like if the patient is having photophobia, then give patient spectacle to cope up with the condition and the glare issue. And this kind of patient rehabilitation is very much important because you know this very well. There is no known treatment for this condition, and ultimately, patient vision will not get stable and it will get deteriorated over time. So, patient motivation and counseling plays a very vital role in cope up with that condition very soon. So, this is why vision rehabilitation is very important. So, till now, thank you so much, and that's all. And I hope this video helped you a lot in understanding about chondrodystrophy and also differentiating these two conditions like chondrodystrophy and rod cone dystrophy. So thank you so much for your kind listening.